Well, Michael is here. Michael, good morning to you.
Yeah, good
COVID-19
morning,
updates. And what's this story, first of all, that a power plant is about to be built in Kenya?
Yeah, I think I know for a fact that it's good news because over the past couple of weeks now, we've been getting stories about Africa making certain moves, in ensuring that they get enough vaccine doses, as we keep on with this fight against the COVID-19 pandemic. But let me just take you straight up to Kenya, where pharmaceutical giant Moderna has signed a memorandum of understanding, that's an MOU, with Kenya's government for its very first mRNA vaccine manufacturing facility in Africa. Now, similar document or similar news broke about some 4 weeks ago, where we brought you a report about South Africa about to open its own vaccination plant. Now, that statement was put out by the company, and the goal, it says, is to produce up to 500 million doses of vaccines a year for the continent, with a focus on drug substance manufacturing. But there's also chances that this facility could be expanded, to start including fill and finish work. There's a tweet from the government of Kenya. I want you to take a look at that tweet. President Uhuru Kenyatta today, that was yesterday, signed and witnessed the signing of a memorandum of understanding between Kenya and Moderna to establish the very first mRNA manufacturing plant right there in Africa. It's good news, and currently Africa, which is the first and the least vaccinated region in the world against the coronavirus, currently relies on imports for over about 99% of its vaccine needs, and this is according to the World Health Organization. Now, back in October 2020, Senegal, Rwanda signed an agreement with BioNTech for the construction of its first start-to-finish factories to make mRNA vaccines in Africa. Now, the novel mRNA vaccine process that uses the genetic code for the spike protein of the coronavirus is said to trigger a better immune response than traditional vaccines, and it is hoped that the technology, which is easier to scale up than traditional vaccine methods, might ultimately be used to make vaccines against other diseases, including malaria, and of course, we know how it's been ravaged in Africa, talking about that malaria and other viruses, Ebola virus as well. I know for a fact that this is good news, Joe and Oluchi, because we have come a long way. We know how long we waited to get some of these vaccines, when the pandemic broke out, recorded so many number of cases. But right now, getting news about vaccine plants being opened in Africa. First, it was Senegal, Rwanda, South Africa. Now we're talking about Kenya. Some weeks back, we also brought you, there were reports that Nigeria is about to open its own vaccine plant as well. It's a possibility, don't you think?
No, not a bad one, though, but I think there were counter reactions concerning that. But I'm happy, as a matter of fact, if we can have plants opened in different regions in Africa, talk about Southern Africa, talk about Western Africa, Eastern Africa, and the likes, then I think it will solve this problem. And looking at the fact that a lot of people are still not vaccinated yet.
Yeah, very true. Now, looking at the scenario that they're thinking broader than just the COVID vaccine, they're thinking of malaria vaccine and other vaccines. I mean, we just brought a little report from Port Harcourt in Nigeria, looking at that young lady who fled Cameroon, the Anglophone part of Cameroon, to come into Nigeria. That newborn she has holding needs those vaccines. The newborn needs a polio vaccine, needs the Rat5 vaccine, needs all the vaccine the child can get to protect the child from that young age to adulthood. So, of course, I like the fact that your brother this time around, they're not just thinking of the COVID vaccine, you're going beyond that.
We'll definitely keep our fingers crossed and hope that these vaccines don't just end up, talking about it in the news. Let's get to see it actually in full manifestation. Let me take you to South Africa, where Universities Alliance South Africa, that's UASA, has given public institutions of higher learning until today to abandon their mandatory vaccine policies or face legal action. The organization, which represents students and staff in universities across South Africa, is preparing a class action lawsuit against several institutions over what it called the irrational, medically unjustified, and unlawful COVID-19 vaccination policy right there in South Africa. They also argue that the vaccination policy violates the rights to human dignity, bodily integrity, education, and labor relations. Now, just a few days ago into the start of the academic year, classes were disrupted at various institutions when protests broke out with students pushing back against the policy and for the COVID-19 mandatory vaccination policy to be set aside and declared unconstitutional. Since the start of the academic year in South Africa, some university staff, students and visitors were required to be vaccinated in order to access lecture halls, accommodation, and also university events. Although some universities have stressed the safety of the vaccine and the need for the policy to secure the future of in-person learning, but it has also been met with hesitancy and reluctancy by students, which of course is a big problem in Nigeria, but in Africa. But the big question now is this the right way to go? And the big answer is no, because the university community, as we all know, is quite large. And you recall that South Africa, has been at the forefront. In fact, they are the country that has been hit the most when you're talking about the COVID-19 pandemic. Now, the university committee is quite large, and you recall that South Africa last week recorded the great feat where it did not record any COVID-19 infection in 48 hours, making it the first time since this is happening since May of 2020. Joe Oluchi, Africa cannot afford to be complacent now. Things must be done right, and citizens must go out there, and get vaccinated. And if you're asking of universities, universities are meant to, inculcate knowledge. Universities are meant to be a place where you come in and you're taught the right thing to do. Not a place
of learning.
a place of learning, not a place where you're told not to take vaccines. I believe that this lawsuit against that vaccination policy in South Africa, it's a wrong step.
Well, it's a wrong step for some people, but for some others, it's their right. They have a right to contest anything that has been brought on their table. But we'll see how the story develops in South Africa. I'm sure you will be closely monitoring the situation in South Africa.
Definitely, I'll be monitoring the situation. But before I get off your face, let me tell you what the numbers are looking like. According to Africa CDC, the continent has recorded more cases. We're talking about 11.5 million cases, and the death has been pegged at 255,260, while the number of recoveries are pegged at 10.708.723. That is 10.7 million recovery cases have been recorded in Africa. There's a lot more we can do. The fight against COVID-19 is not just left for the government alone. If government brings out policies, we should ensure that we play our own part to make sure we defeat this virus. Back to you, Joe and Oluchi.
Thank you so much, Michael. Spot on and letting us know what's happening.